Hey everyone, it's Anissa. Welcome back to my channel. So I know it's been like a little second since I recorded, but it's mostly because I just graduated from cosmetology school. Yay! I'd like to say thank you to everyone who came on to the video before my last video to say congratulations for the graduation. I'd like to thank my grandmother because she's the one who put you guys up to that. Thank you for that. It really did take a long time to finally get out of that class. It was a lot of fun. It was just a lot of waking up at 5:30 a.m., staying up till 4:30 p.m., and then even after that to do homework and things like that. So it did get really hectic. But yeah, I'm done, and then I go for my test very soon. And yeah, so thank you again for all the congratulations. I'd also like to say thank you because we've hit over 50 subscribers now, and I think that's awesome because I was stuck at 27 for a little bit. So thank you to that too. That's not what this video is about though. This is my, as you can tell from the title, my 1 year since my breast reduction. So before we actually get into that video, because I'll be talking about things I went through with that, things like questions that people always ask me, and like little comments and like things about my surgeon that I really liked about her and things like that. So before I even get to the video, just don't forget to like and subscribe, comment down below whether you're getting a breast reduction or if you have questions or if you've gotten it done, and tell me your story because it's really interesting and it's really cool to know that there's people out there who have very similar reasons and backstories as to why they got this done as I did. So yeah, let's just get into the video. Okay, so I think it's really crazy because if you follow my Instagram, which I have linked down below, Anissa_C_love, my Instagram is set up as a business page. So at the business page, you can see what is your like biggest, what gets the most views on your Instagram, what is your all-time like biggest view for your posts, like what do people see the most, so you start posting more things like that. My top 2 posts are when I posted about my breast reduction and about linking it to my YouTube talking about my breast reduction. And I think it's really interesting because before my breast reduction, I had never really heard about breast reductions a lot. I had always heard about breast augmentations, which is when you get them bigger. So you get like the little, I actually don't know the surgery for that. I should know. You get things put in rather than taken out for those. So I didn't know breast reductions were really that popular, especially since there were a lot of girls my age who had really big breasts and no one was talking about getting breast reductions. I was always the one who was making my jokes about getting a breast reduction and things like that. So it's really interesting seeing that a lot of people are actually looking into this, and I think it's really crazy. That's one of my top posts on Instagram. And mind you, I didn't even write anything about my breast reduction on it. It was just a picture saying, hey, don't forget to go click the link in the bio, which was a link to my YouTube videos talking about my breast reduction. So my 1 year was officially June 30th, but I was thinking about posting that day, but school and I was tired, and every time I went to go post it, something would come up, and so I'm going to get to that right now. So my big reduction was back in June 30th, 2017. Then December 20th, I believe, 2017, I went back for a scar revision. It was scar revision / lift. She just wanted to lift it a little bit more because of how swollen they were, and then when they started going down, the breasts themselves started going down. She was like, uh-oh, you're sagging again, so let's bring them back up. So she did a lift and a scar revision, which is just your scars are so prominent, so the scar revision's to get them inward so you don't see them as much anymore. So that's what she wanted to do. So I went in for that, and it was like a 45-minute like procedure. Like I was in and out. The initial surgery back on June 30th, it wasn't that, like, I got through it really fast. I recovered very fast. I was very upset that for 2 months I wasn't allowed to do anything. I really wanted to get up and be able to actually like go for a run and not feel self-conscious about it and things like that, but I couldn't because 2 months, the stitches were still in. You don't want to rupture the stitches and then combust. So that surgery and the recover time was perfect for me. I wasn't in too much pain. The only thing is that I suffer from anxiety to the point where I pass out. So if something really freaks me out, I pass out. So after 3 days after my surgery, they told me I can finally take a shower after the initial surgery back in June. So I was scared to take a shower, so I waited till July 4th. So I was sitting inside July 4th, and it was nighttime, and I was watching a movie. When the movie ended, I think I was watching Orphan. No, I was watching Carrie, the original, for the first time. Good movie. So, and the movie ended, I decided I may as well just go take my shower. So my parents were inside by that point with my siblings, and everyone was done watching fireworks and things like that. So everything was fine, and I decided to go take a shower. Well, when you first take off your sports bra that you're supposed to be wearing, it's supposed to be zip up in the front or pinned in the front, whatever. When you take it off, you can then take out the padding that's in there, because the padding's sitting in there to hold any moisture, to get rid of the plasma and things like that that's oozing out. Sorry, this is really descriptive and gross. But, so I got to take all that out, and it was fine. But I looked at it, I was like, ew, that's gross. But whatever, it's been sitting in there for a couple days. So I threw it away. And then when I was getting in the shower, I got a washcloth so I could soap up with a non-scented soap on my breast without having to touch it with my hands. And then that one washcloth was meant for my chest, so I didn't cross-contaminate, like any other bacteria on my body to my breast. So I had 2 different washcloths. The one I was using on my breast, when I pulled it away, it was yellow, and it was a white towel. And I was like, ew, that's gross. So then I started kind of being like, that doesn't seem right. And then like my head kind of started spinning, and everything got really foggy. And I was like, nah, it's just foggy because it's a shower. Like, I'm in the shower, everything's foggy, it's just like whatever. So I wasn't really too worried about it. And then as I'm still soaping up, I was like, okay, I'm feeling really gross. I started getting like nauseous kind of, but like you have nauseous, and then you have like nauseous to the point where you're going to throw up. I wasn't going to throw up, it was just nauseous. So I was like, this is weird. So I turned off the shower and everything. I got out, and I could only wear button-ups because you're not allowed to lift your arms above your head for the first 2 months or whatever. So I got out of the shower, and I had like an extra, I bought 2 of these zip-up bras for the front. So I was putting on that one, and as I'm putting it on, I sit down, and I close the toilet, and I sit down. I'm sitting there, and I can feel myself getting faint, and I'm like, oh no. Like, everything gets really foggy, everything starts spinning, I start losing my vision. So I'm like, okay, let me at least get a bra on before I start calling for my parents and they walk in on me naked. So I know, I like how that's like my first reaction. I'm like, oh no, don't be embarrassed, while I'm about to literally faint. I think fainting in the bathroom is really scary to me because like you have counters and things like that. Unless you have like a really big bathroom, but my bathroom's pretty narrow. So if you faint, you're gonna hit your head on the counter. So that's why I was propping myself up on my elbows. And I was propping myself up, and I was kind of leaning to the side. So if I did faint, I'd lean to the side and just like softly fall into the wall because the wall's already right there. So it's not like I would smash into it. I would literally like nicely fall into it because I fainted in the past and fallen. And it's not fun. So, I was making sure, like, if I was gonna faint, I was gonna fall over. So I had my bra on, and I think I even had already put padding in it. Yeah, I had my padding open and everything and sitting on the counter. So I had already put my padding in, and I'm sitting there really slowly zipping it up, about to faint. I'm getting my button-up shirt on. I have one arm in the sleeve, the other one's, like, I'm trying to find the sleeve, but I can't. Like, that's how faint I was. And then I was like, hey, Mom. And she's like, yeah? I'm gonna faint. And she's like, oh. So she comes in, and she sees me, and she's trying to, like, stay calm. And she's all, so she tells my dad, and she's like, hey, babe. And he comes in, and he's all, what? And he's seen her, like, drinking apple juice. And my thing, we've gone to the doctor, we talked about it. I think I have, like, a low blood sugar issue, but they say no. But it's really weird, because whenever I have my anxiety attacks and I'm starting to pass out, sugar brings me back in. So I have to have some type of sugar that will help me. When I got my tattoo, I almost passed out, and the guy next to us had like these little like Hi-Chew sugars. Yeah, Hi-Chews, and they're like these little like sugar candies, and he gave it to me, and the minute I put it in my mouth, I felt better. So my mom took my dad's cup out of his hand, gave it to me, and I took a sip and I instantly started feeling better. And she's like, the minute you took a sip of that, your color all came back. She saw your face was white, your nail beds were white. Like, how does that even make sense? My nail beds were white. I'm like losing oxygen. That's why I'm about to pass out. And it's weird because like I hyperventilate when I like when I'm like panicking. Like, it's not like I'm sitting there trying to catch my breath. Like, I'm taking in deep breaths. I'm trying to figure it out and I'm still pass out. So that's why I was like, oh, I don't want to take a shower ever again. So I was really freaked out after that, and I talked to my mom about it, and she was like, oh, well, it's plasma and you have a lot of it, so it's gonna be yellow, so like there's nothing to freak out about. So that's why like I calmed down a little. And it was funny because like I always say like, oh yeah, my recovery was the best, except for the fact that I almost fainted. So I mean, after that day I was fine, especially with the idea in my head that that's gonna happen, it's gonna look like that, especially since I was such a big surgery. If you haven't seen one of my past videos, I had 2.5 pounds taken out of each side. So I was a very big surgery. So there's gonna be a lot of oozing and things like that happening. So it was bound to happen. I don't think I've told really a lot of people that story, just because it's weird to me that I almost passed out in a shower for literally no reason. But usually that's how it goes for me. I panic and pass out over nothing. Yeah. So there was that. But other than that, the surgery was fine. Towards the end of the surgery, I started, end of the recovery, I started getting, it was like a fungus underneath, and it was kind of normal because there's plasma and everything, and that means you should be changing your pads in your bra like twice as much as you normally were. So like instead of changing it 3 times a day, you should be changing it probably 6 times a day. And it's normal to get a little fungus under there, especially with such a big surgery again. So I just got a fungus, and we were able to get a antibiotic going, and I was able to get that cleared up super fast. So if you see any redness or itching or anything after getting this surgery, make sure, I mean, like, of course your first couple of weeks you're gonna be itchy because, you know, your body's trying to recoup and it's going to be trying to close up those stitches because, you know, it's an open wound, and then when you get open wound and it's healing, it starts itching. So it's gonna start itching within the first couple of weeks. But towards the end, or even like at a point, you should always be checking them too. So like it's okay to open your bra and check to make sure it's not red and infected and everything else. So, but make sure, because if you see any red dots or if it's starting to itch or anything, it means that you should probably go back and be like, hey, I think I have a rash of some sort, because it doesn't hurt to get that checked out. But we got antibiotics and it was fine and everything was perfect. So it went away, we were fine, and then she was talking about doing the scar revisioning in December. So we were totally fine with that, and it was just weird because by the time I was ready to begin to like move around and do things again, that's when I was starting school. And it was so weird going to a school, because I was thinking of it as a fact of like, you're gonna see all your friends and be like, oh my god, you look so different, things like that. I was going to a new school because I was starting college, so it was still really weird to me walking into a college and not having everybody be like, hey, you look different. Like, it was just weird. I don't know, I was expecting attention in a sense, but I wasn't getting it, and I was like, this is so weird. But I didn't make a big deal out of it. I didn't be like, hey everybody, look at me, I got breast reduction. Like, it wasn't that big of a deal to me. But once we all became kind of like known to each other, we all started, you know, exchanging Instagrams and stuff, and that's when girls started realizing that some of my photos from a long time ago, my breasts look huge, and then now they look a lot different. So they're like, what is that? So I explained to them about the breast reduction, and everybody was like, oh my god, that's so crazy, and blah blah blah. So things like that. It's so weird thinking about like people react so weird to it because they're like, who gets a breast reduction? Aren't big boobs like a good thing? But I'm like, it's really not. People say it's a good thing and it's like wanted and things like that, but oh my gosh, it's so much pain. But yeah, so in December I went for the surgery, and it was 45 minutes long. It wasn't that big of a deal. I was making sure to clean it as much as I could, and like by cleaning it I mean switching the pads literally every hour. I didn't have to go through what I had gone through again. But within like 2 weeks, I think, I started getting the rash again, and we were really freaked out by it. And my doctor was like, oh, it's so weird, like this wasn't even that big of a deal, like okay, let's just put you on the same antibiotics or whatever. So she put me on the antibiotics and it wasn't going away. If anything, it was just spreading more. And she was like, this is so weird. So I was on like 3 different pills at the same time trying to get rid of it. And she was like, this is so weird. This is literally the most simple surgery in the world. Why is this happening? So it was the weirdest thing, but we ended up getting rid of it. And after that, it wasn't really that big of a deal. And it was really cool because it was gone. But it was still really weird because like we still don't know like why it just wouldn't go away. It was like nothing that had worked before was working, and it's not like I was on it for long enough for me to build up a resistance to it before. I was literally only on this medication for like a week, but it didn't want to work, and if anything, it was spreading even more after, so it was just weird. And that was my Christmas vacation. I was like, yay, Christmas vacation. I'm screwed up right now. Since then, I have seen her. I saw her until April, and then she said that I was an outpatient at that point. We were good. I would only have to see her if I absolutely needed to, which with the heat, I got heat rash, but I was scared that it was that weird rash again. So I called her and I went to her and she was like, literally just put hydrocortisone cream on it, you'll be fine. So I panic now whenever things like that come up. I'm like, oh no, because it also is only on the scarring, but that's because the scarring is more susceptible to having like any infection or rash or anything like that. So that's cool. A lot of people have asked me if this was really beneficial and if like I could go back, would I do this again if this was given to me? I absolutely would, because I feel a lot better. My posture is a lot better. I used to literally sit like a question mark. Now I sit up straighter. I don't feel like I'm in as much pain, but my back is very weak from the years of having that weight on my chest. So I just started physical therapy again for the first time since my surgery, my June 30th surgery. I stopped going to physical therapy in I think it was May. I stopped going in May because I wanted to have somewhat of a summer before my surgery. So I told them I'll be back, and they were like, cool, peace, whatever. But I'm back, and a lot of them were like, wait, you're really back? I thought you were just kidding. But I was like, no, I'm back. I need to be here. And besides, I like this place. I love my therapy, my physical therapy I go to. They're great. They all know what they're doing. They all help me out. They know the issues I have, so they're really quick to let me do everything like I need to do. And I also know where everything is, because I was going there for a year before. So like to this day, I still know where everything is. I can walk in and be like, okay, I'm gonna go do the reformer. And I'll go over and I'll grab a blanket, 'cause I have a bad back. So because the reformer is like a piece of wood you're laying on, it hurts my back to be pressing against it. So I go get like a fluffy blanket and I put it down. And like for the people that are new there, they're like, why are you getting a blanket? I'm like, oh, 'cause my back. And they're like, yeah, she does that. So, but my lower back, I don't think my lower back has had an actual, effect since my surgery. I don't feel like my breasts were stopping me from anything or causing anything with my lower back. My herniated disc is just a herniated disc, and that's how it is. I don't feel like that'll ever get better. So this reduction wasn't really meant, this reduction really wasn't meant for my lower back. It was mostly meant for my shoulders, especially since like literally a couple months, a month before I went in to like see an actual surgeon for this surgery, my shoulder had gone out on me. It spasmed and went out on me because of how weak it is up here, because it was holding so much weight up here. So it had gone out on me, and I was like, this is it. We're cutting them off. If a surgeon doesn't want to do it, I'm going to become a surgeon and do it to myself. Like, that's it. So this really helped my upper back, my scoliosis and everything. I mean, yeah, my scoliosis still affects me sometimes, and it still hurts. And that's why I'm going back to physical therapy, because it's good to find ways to strengthen my upper back, because that's exactly what I need, especially since school was hurting my upper back a lot, because learning how to braid hair certain ways, and I had a doctor's note saying I was allowed to sit while working, but it still didn't help the fact that when I'm sitting and working, I can mostly do updos, and doing these updos include braids and twists and things like that are causing me to keep my shoulders moving. And the whole time I'm moving, the whole time I'm working, it's just it's like an exercise for my back, but it's so much for 9 hours a day that causes my back to start spasming because it's not used to it, and it starts hurting really bad. So going back to physical therapy, when they were like touching my back, they're like, "You're a giant knot." I'm like, well, let's be real. I've been a giant knot. When I used to come here, I was a giant knot. I am still a giant knot. It's just a giant knot from something else. Before, it was because of theater, because I was doing makeup for my theater, which I really miss. I really miss makeup with theater. So that's why I'm really happy I'm graduated, because I really want to go work for Disney's cosmetology, because they are literally theater, and I think it's awesome. That's what I want to get back into. But that's more the reason why I need to strengthen my upper back, because I need to be able to keep moving and keep working and things like that and keep going, and that's my biggest issue. So physical therapy is really great, especially for those of you who are getting the surgery because you have scoliosis. After your surgery, your shoulder is going to be feeling so much lighter, but they're also going to be super weak. So you need to strengthen them somehow. So talk to your doctor about going to physical therapy. That helps a lot. Even my surgeon told me, Dr. Olaya, she even told me that this would be super beneficial, going back to physical therapy and strengthening my back. I'm going to physical therapy for my upper back, herniated discs, and my knees, kind of deformed, messed up knees. It's a long story. I don't even know what's wrong with them. There's just a lot. The most I know is I'm knock-kneed, but then there's like millions of issues along with the knock-knees. I don't know, but just, it's like a whole separate thing. I could do like a whole video just meant for my medical issues, and that would be like 2 hours long. So just keep it at that. But it was interesting because I follow my surgeon on Twitter, and she doesn't have a lot of followers, but she's always posting about these articles that come out about plastic surgery and whether like laser removal is good, and like scar tissue and like things like that. And she did post one about the rising epidemic of breast reductions within teens. And I thought that was really interesting because I was like, whoa, like I never really heard about it until after my surgery, but that's because after my surgery I was Googling it so much it started coming up a lot. But still, when I was looking it up, I was seeing a lot of women that were probably in their 20s or older, or even like 20s, 30s and older. So to be reading this, it was really interesting. I actually sat down and read the whole thing, and it was just this girl, and she was writing this article about how she was 18, she went in to go get the surgery done. And she was talking about how the surgeon looked at her and was like, oh, it's so weird you want to get this reduction done because don't boys like big boobs? And it's like I had a lot of people tell me that, oh, why you want to get breast reduction? Don't guys like it? And I'm like, I don't care what guys like. I'm in pain. Like, last thing on my mind is a guy. Like, if I'm out and I see a cute guy, I'm not thinking about the cute guy. I'm still thinking about the fact I'm in pain. Like, I'm not thinking about anything else still. So for people to say that all the time is very irritating, and to know that I wasn't the only one that people would say that to. And for the most part, it was my friends and even like my mom's friends that would say things like that. But for the surgeon to say this to that girl, like that bothers me a lot. Because I'm like, that's so weird. Like, why would he have to, like, why would your doctor try talking you out of a surgery like that? Why would they try to talk you out of that by saying, oh, you'll be more attractive if you don't do it? Like, that bothers me. But just reading about the fact that, you know, this is very common nowadays because a lot more girls are realizing, like, it's painful. I've had a lot of people message me and ask me about it because they all have bigger breasts, and they ask me like, oh, will this be beneficial? What were some of the side effects for you? Do you regret it? And I'm like, I don't regret it. I think it's the smartest thing you can do if you're in pain. Your body is to carry you for the rest of your life. I think you should take care of your body as much as you can, even if that means getting surgery done and fixing it. So exercise, eating well, and God forbid you have pain in a place and surgery can help and will fix it, I think do it. Like, if you have like a 90% chance of fixing that issue, I don't see why not. I mean, I get it if it's like you have a huge chance of it fixing, but you also have a huge chance of never being able to walk again. I would say probably don't do it, because then you're safer at that point, because you could have a possibility of never walking again. That's how like the herniated disc is, because it's on your spinal cord. So one wrong nick can cause you to become paralyzed from the waist down. So that's why they recommend us not getting our discs. That's why they recommend us not getting surgery done on our lower backs. So that's that. So like you're kind of screwed with it, and you have to learn how to just deal with it and what you can do and what not, and what you can't do, which sucks because at my age I shouldn't have to be stuck like that. That can be a separate video. We can do a separate video on that because that's a lot. This is about the breast reduction. But I also had a lot of people tell me that, like, who are in a lot of pain, that their biggest issue with the idea of getting a breast reduction is the scarring. And I just think that's kind of lame. Like, I get people don't like scars. I hate scars. I mean, I have acne scars and it sucks. I keloid easy. So I have keloid scarring on my chest. On only one side, actually, now I'm thinking about it. I mean, like, I have keloids underneath because the way they do it is like an anchor. And then it goes under your boobs. So, like, I have a lot of keloid scarring underneath. But for some reason on my right side, I have keloid scarring around the nipple. And then on this side, I don't. I don't know. But I have, like, a lot of keloid scarring on my shoulders from acne growing up and things like that. And yeah, scarring sucks. But there's ways to really help scarring. I mean, there's oils you can be using. Vitamin E oil is amazing for getting rid of scarring. Just keep, like, the minute they, like, ask your doctor, like, hey, when's the soonest I can start putting, like, vitamin E oil or something on my chest to stop, to, like, at least lighten the scarring, ask them, because they'll tell you, like, right when your stitches come out, you can start putting that on, because it really did help. My scarring was really dark, and now putting vitamin E oil on, they're actually a lot lighter. So there's nothing wrong with doing that, and I've even told these people that, but they say, like, oh, but I still want scarring, but I'm like, any surgery you get, you're gonna have scarring of some sort, and there has to be a way where they can minimize the scarring, where your doctor can do a scar revision. If you want to pay for the scar revision, you can. I don't know how much it would be, but you can get the scar revision done and be putting vitamin E oil or something on to try and minimize that scarring. But I think scarring is nothing compared to the pain that you're in for your whole life. So I would choose scarring over pain. And again, I don't like scarring. I hate scarring. I also hate that keloid easy because then I have these stupid bumps on my everywhere. And it sucks, but I chose my body over scarring. Or no. Yeah. Because I don't care about the scarring. Does that sound right? I chose scarring over I chose my body over scarring because honestly the scarring I don't even care about. Like, I still look in the mirror and look at it and I'm like, wow. I'm still not used to this because, like, it's still amazing to me that 2.5 pounds off each side can really do that big of a difference for my body and for myself and for how I look. And it's really amazing. Like, I had a lot of issues finding clothing because my breasts were so big and I was like a size 3X when in actuality now I'm only an extra large. It's honestly amazing. And a thing that I kind of found after I got my surgery done was that this is something that you will get over if you stay confident and you tell yourself that you love yourself and you believe in self-love and positivity, and you're always gonna have your days where that doesn't really help, but this is something that you should really think about and everything as you get out of the idea of after your surgery, was that once I had my surgery and everything, I looked in the mirror, my stomach looked a lot bigger then, because you have these breasts that are hanging over your stomach, so your stomach looks smaller, but then the minute you bring them back, your stomach looks bigger. And that was something that kind of bothered me at first, because I've always grown up as the chubby kid, as the bigger kid, so, and I also got bullied for being a bigger child as well. So, when I saw that, I was actually kind of upset, but not as upset. I was upset by it, but at the same time I was really grateful for not being in that much pain. But for those of you who do have, like, body dysmorphia issues and things like that, did I say that right? Body dysmorphia? I think I said that right. I'm not completely sure. But for those of you who have issues like that, I think staying positive, self-love, self-care is very important. If you have that while also wanting to go get the surgery done and getting the surgery done, please, dysmorphia? I'm still stuck on that. Is it body dysmorphia? I think that's what it's called. But basically, if you're super insecure about your body and you see that and it freaks you out, just remember you're beautiful. that doesn't define you. You will get over it because it sucks looking at it, because I was very disturbed by the fact of how big I looked after, but you will get over it. And I think self-love, again, is the biggest thing. Keep people who love you around you rather than the negative, because the negative do bring that type of thought process out, because when you're around negative people, you start thinking negatively, and everything you see and do is very negative. Keep positive people around you, people that make you happy, because then that won't be that big of an issue to you. You'll stay more positive, and yeah, every once in a while you'll look in the mirror and be like, ew, but it won't be as much. And also, I don't know, just stay positive. You are beautiful, you are amazing, whether you go through with the surgery or not, whether after the surgery you look bigger than you did before when it comes to like all your other body proportions. And if you just decide that this isn't the type of surgery for you, but you are in pain, there are a lot of exercises and things you can do to strengthen your back, so your back can then hold that weight on your front. So this isn't the only way out, but it's the easiest and most beneficial, because it's not going to take as long, and you're not going to be in pain as much either. I went along with this because I instantly wanted to pursue things that I needed my upper body for, and trying to train my upper body for years wasn't going to be beneficial for me. So that was the biggest issue, and that's why I decided not to do it. And that's why I decided to do it, to go ahead and do the surgery rather than try to strengthen my upper body, because that would have taken 3 or more years. And I wanted to jump straight into my my passion and my schooling and all of that. So that was that. If you have any questions or stories you want to tell, please leave them down in the comment section below. I will love reading all of them. I honestly love reading what you guys have to say, especially reading other people's stories about their surgeries and their scoliosis and things like that. So if you had any type of surgery that was beneficial like this, you can tell it down below. I don't have an issue with it. Just keep it positive in the comments, and yeah. Don't forget to go follow my Instagram and Twitter is both Anissa_C_love, and my Facebook is, I believe the same, Anissa_C_love. I leave it all linked down below. Don't forget to follow my blog, which is just AnissaClove.com, and yeah, I'll see you in the next video. Bye!